morning, everybody, from Global Eco Radio Station for Smile and Shine. Today, we have a very, very special guest that is Yinka Adekugbe, that he's joining us from Illinois today. Thank you for joining us.
Thank you so much, Claudia. I'm happy to be here.
So, likewise. So Yinka is a wonderful person and a friend of mine that I met in Boston a few years ago. Dr. Adekugbe obtained her bachelor degree back home and moved to America a few years ago, where she did her DMD at Boston University. She has a special interest in dental public health, where she did her master at New York University, where had the opportunity to develop a special interest in access to dental areas. And this is the part that Dr. Yinka developed over the years. And beside that, she also has a 501c organization in Iowa that provides dental care for underserved population, both in the United States of America and in Nigeria. What a remarkable profile. And welcome. Thank you for being here. And today I would like to ask you some questions because we are absolutely honored and pleasured to have people like you for Smile and Shine, people that are giving an important contribution to, of course, the world of science, medicine, and dentistry, but also in the world of public health, because it was a topic that I wanted to talk about at Smile and Shine, because public health is nothing else than dentistry applied at the population level. And I'm very, very pleased to have an expert here. In fact, Dr. Yinka is also a clinical assistant professor at the University of Missouri, School of Dentistry and Oral Health. So, where do we want to start from?
We start from the beginning.
Yes. So, Dr. Yinka, let's start from introducing yourself. Let's start from your educational background. Tell us a little bit about your past, but most importantly, tell us where you want to go.
Okay, thank you, Claudia. So I'm happy to be here. Like I said, I'm Yinka. I'm from Nigeria. I did my bachelor's in dental surgery in my country, back in Nigeria. My love for dentistry started with a pediatric dentist. Can you imagine that? Oh yeah. As a child, once I had an extraction, and I just fell in love with dentistry immediately. And I'm like, okay, I think this is where to. And I did my bachelor's in dental surgery. And over the years, I picked interest in public health and prevention as a whole. So did a master's in dental in public health in NYU. Did an MSc in dental public health in University of Iowa, and a residency in dental public health. So that's been what I've done in a nutshell: prevention, access to care, prevention, access to care. That's what I'm all about.
Oh, wow. So it's a topic that you've been developing in over a decade now.
Yeah, I must say.
Okay. So what are you currently doing in terms of increasing accessibility to healthcare, and particularly dental care in the United States and in Nigeria?
Okay, with regards to that, we've been doing a lot of programming in terms of prevention, providing information, providing culturally appropriate information, because especially for the United States, we have a diverse population with regards to the underserved, where we work in Iowa. So we have the immigrant community, and they speak different languages. So we've been able to translate oral health education material into Swahili, Arabic, French, appropriate language to improve access to care for the immigrant population. We also use community navigators that go into the to talk to people about the importance of oral healthcare and linking them with access to care. In the future, we've written grants, so we are hoping to get more money so that we can have our own preventive dental clinic where we provide some sort of preventive care to our populations in the population we work with. In Nigeria, we've been doing a lot of awareness and screening. We do know that in dentistry, school-based dental program is one of the most cost-effective intervention you could have. I would say it's the most cost-effective intervention in public health generally. So we've been doing school-based screening where we screen the children, provide them with some profi, cleaning of their teeth, and just do a traumatic dental restoration for those that need it. We are hoping to refer those that need higher level of care to where they could get it. So that's what we've been doing in a nutshell, just prevention, awareness.
Wow! What a remarkable job that you're doing. So you're basically taking care of people coming from different backgrounds, but also different age population, and you're giving them different type of dental treatments in order for them to have accessibility to the system, right? So, Dr. Yinka, you have been in this field for at least 10 years, and so you saw the system inside out and you studied it also. What do you think are the biggest challenges ahead, and how do you think and which measures do you think need to be taken in order to tackle this problem?
I think the biggest challenge in dentistry and oral healthcare generally is political will and importance of dental care. So making dental care a priority in our discussions generally globally and both at the country level, giving it the priority and the attention it deserves. So I think if we can have more political will and more political commitment from our leaders on the importance of oral health, we'll gain more traction in moving our dental care or access to dental care agenda forward.
Oh, yeah. Yes, for sure. Political power would be absolutely needed. What else would you indicate?
And then I would also think also we beginning to see the medical dental integration
Okay.
fully begin to see that dentistry is not in silo. It occurs as part of the whole healthcare or the whole continuum of care. So that as we begin to give priority to healthcare generally, dentistry becomes automatic part of what we're giving priority to. So if we could have that in dentistry, we use the word amalgam. So if we could amalgamate it more and blend it well, let me use my dental term so that we have
Yes.
a so that we have a firm mix to the dentist listening to this, so that we need to have that amalgamation and make sure that everything is well set. And then we could now begin, so that as health begins to move up the agenda, oral healthcare automatically moves up the political agenda too.
So you think that as of today, we haven't reached enough integration between medical care and dental care?
Yeah, we have not reached enough integration because of the basically in a place like United States where people go to different places, so you're seeing your doctor in another place, you're seeing your dentist in another place, and sometimes it just makes, especially for patients that have low dental IQ, it just makes everything very cumbersome. Sometimes people want where they go to one place and they know their doctor is there, their dentist is there, everybody is in one, it's a one-stop shop. So as we begin to integrate things better and we have those kind of one-stop shop model where patients know that this is my home, this is my health home. So when I come here, my children get to see their dentist, their pediatric dentist is there, their general dentist is there. This is where the mother receives paternal instruction. So when we begin to have those kind of integration better, then services are well integrated and people can have better access to health
Oh,
and dental.
Yeah, absolutely. And so, having seen different systems and having been exposed to different educational systems, if you have to highlight some differences between what you learned in Nigeria and what you learned in the United States of America, what would you tell?
I think if I have to highlight, I would say in Nigeria, the Nigerian training taught me the integration of medicine and dentistry very well because its dentistry is well situated in the overall health system in Nigeria. America does have its own advantage in the silo. We could see that dentistry occurring in silos as advanced more. We have more advanced dentistry in America compared to where I'm coming from. So, like I said, everything does have its give and take. A country like Nigeria, you won't patients won't fall through the cracks. A dental patient might probably not fall through the cracks once they present in a health system or present in an ER. They probably not fall through the cracks. The system will absorb them and they will be able to see a provider, a dental care provider. But in terms of technology and the kind of services we are able to offer them, we might not be able to offer them as much service or as much options as we would do in the United States. So, like I said, everything does have its give and take. So there's no perfect system, but we want something that it's universal healthcare says something people can have access to and what they can use that's meaningful. So that's it.
That's wonderful, and it's a very, very, very good take-home message for today. So, if this is your opportunity to call for activism, and if you need to leave a message for today, that will be highly appreciated. I know you are a wonderful clinician, and beside that, you also have this interest to apply dentistry at a population level, in particular accessibility to healthcare. And this is very noble of you, and this makes of you a great doctor. So, which last message would you like to give to our audience today?
I would say let's start viewing dentistry as a social justice issue. The same way health is a social justice issue. People deserve to have the needed dental care, the minimum needed dental care. It might not be technology, it might not be so technologically great, but the basic care should be affordable to the people that need it. And we all are advocates. The dentists cannot do it together. Everybody needs to do it with them and push the oral health agenda forward.
Dr. Yinka Adekugbe, clinical assistant professor, University of Missouri. Thank you for being here today. It has been a pleasure and honor to talk to you, and hope to have you again.
Thank you so much, Paul. Bye.